K-tape for the hamstring to make sure the muscles lengthen. So you've got hip into flexion. Dave ideally in a comfortable enough space where he's not going to cramp up or anything like that. Keep in mind that right now it's a proximal tendinopathy, so it's up to the ischial tuberosity. So that's where we need to try and get the tape. Knowledge of anatomy and physiology is important because we're just replicating those different heads of the hamstrings. So extend that knee for me as well. If that gets uncomfortable, you just say okay. So first strip, we don't want to keep in that position too long, so I'll go quite quickly. We're going to tear the backing paper to create 2 anchor points. So those anchor points need to be applied under zero stretch, but this part here does need to be applied under about 50% stretch. So 50% stretch is going to be 100%, back off half. So not too much. Dave's already in a stretch position for the hamstrings, so that's going to create most of the stretch that we need. We'll find the ischial tuberosity, somewhere around there. Pop the tape on, 50% stretch, and we can come around, aiming for the head of the fibula, but somewhere in that direction, just to make sure that we get the biceps femoris lateral part of the hamstring. Peel off those anchors under zero stretch. And make sure that you give a bit of a rub, and you can use the backing paper as well to heat the adhesive and to get it to stick a little bit longer. Second strip's going to go on because hamstrings are such a big muscle group. It's time for the medial side. Same procedure, backing paper off, somewhere around the same start point for the ischial tuberosity, and then around to the medial side. 50% stretch, don't need much more than that. Anchor strips come off. That's quite pleasing, isn't it? Heat that up. It's worth spending some time doing that because this will then stay on for 4, 5, 6 days. And then for the last strip, this is the one that's going to be treating the affected area. So we've got hamstring strain, and somewhere around there, that's where this is going to go. But because it's a proximal tendinopathy, we're looking for that ischial tuberosity there. So we're going to try and cover that just about there. So I'll move the towel just for this bit. With a smaller eye strip, we just tear halfway down, take the backing paper quite close to the edge, and that becomes our little handhold and also the anchor points. So let's apply a good 75 to 100% stretch there onto the ischial tuberosity, pop it down, heat it up while the anchor strips are there, peel them off, zero stretch, it's going to stay on a little bit longer. Heat the whole thing up with some friction with the backing paper. And that would be K-tape for hamstring proximal tendinopathy.